All right, good afternoon. Good afternoon. Welcome, everyone, to Hello Health session. We're in March. We're in March Hello Health session. And so this month is National Nutrition Month. We're talking about maternal health, child health as well. My name is Ishmael Meacham. I'm a community health worker, regional community health worker based here in Cumberland Health Department. I'm also with some wonderful colleagues of mine. There's Taryn and Ms. Tabitha. If you'd like to introduce yourselves, tell us a little about yourselves and what we're here for today.
Yes, my name is Taryn Staley. I am the interim breastfeeding coordinator and breastfeeding peer counselor manager of the WIC program here at the Cumberland County Health Department.
Yes, and I'm Tabitha Collier. I'm a nutritionist too with the WIC department here at Cumberland County.
Amazing. Amazing. Thank you for the introduction and getting us to know. So we're here to discuss nutrition. I just want to ask you all, as far as your own conceptualization of ideas of nutrition for mothers or children, do you all have any specific points of kind of like generalizations that you may have just off the top, just to kind of get the conversation going?
Yeah. So nutrition is definitely a balance. No one is going to eat right all the time.
Yeah.
I'm not the person who talks about cheat days and different things like that because it's all about balance. Balance your fruits and vegetables, balance things with things that are unhealthy because we're not going to eat well all the time. But nutrition is essential for personal health.
That's very true. I agree.
Yes.
How about you, Ms. Tabitha?
I agree with everything Taryn said. Everything is also in moderation. We're not saying that you can't have this or that. It's just in moderation.
Yeah, I've learned balance is definitely key. With the nutritional side of that, and also the maintaining your body, mentally and physically, those things is definitely balance oriented. And let's see, I don't want to spend too much time. I want to kind of get into some of what we have prepared. We have some here from the WIC office. This is some information coming here from the WIC office. Ms. Tabitha, would you like to go ahead and get us started
Sure.
with some of our presentation here?
Sure. I'm just going to talk a little bit about what WIC offers and who can apply for WIC. First of all, we'll talk a little bit about WIC. WIC is a federally funded nutrition program that provides supplemental foods, nutrition, and counseling and education, healthcare referrals, community services for pregnant, breastfeeding, and non-breastfeeding postpartum women, infants, and children under the age of 5, nutritionally at risk in a low-income status according to the U.S. Federal Poverty Guidelines. WIC provides healthy foods with essential nutrients like folate, calcium, iron, vitamin A, C, and D, as well as foods with low fats and sugars. Nutrition education and counseling is given to every participant in efforts to promote healthy and nutritious eating. WIC offers breastfeeding education and support through the Breastfeeding Peer Counselor Program and other local resources like breastfeeding support groups and lactation consultants. To meet the needs of our participants, WIC provides referrals to community resources such as food bank, pantries, medical providers, care management or social services, charity organizations that may help with diapers, clothing, car seats, and other infant and children necessities. WIC does serve many people. Some of the people would be the pregnant or postpartum women, breastfeeding women, infants and children on ages 1 to 5, breastfeeding, non-breastfeeding postpartum women who had delivered a baby in the last 6 months, breastfeeding women who have had a baby in the last 12 months, infants and children up to 5 years of age. And then the residents who may qualify for Cumberland County WIC are residents of North Carolina, residents that are within the income guidelines, residents that have some form of ID.
Okay.
Acceptable forms for WIC eligibility, proof of identification, such as birth certificate, social security card, a current photo, driver's license, or military ID or passport. Medicaid card or a Medicaid acceptance letter are some of the proof of identifications, as well as for proof of residencies. It could be a utility bill no less than 60 days old. No older than 60 days old, lease or rental agreement, Medicaid card or approval notice, banks, check stubs, and etc. And acceptable proof for WIC eligibility, proof of income, paycheck stubs, Medicaid card, most recent end of month's LAS for the military family, unemployment letter, or food stamps eligibility letter. The NC WIC program income guidelines, there is a link that you can go to see the full chart of the gross household income. It goes by the number of people in the household and your income annually, monthly, bi-weekly as well, or weekly pay. So for instance, if you have a household of 2 in your family, your annual income cannot exceed $36,482 to participate in the program. And then, so as far as your first initial appointment at WIC, these are some of the steps that you will go through. First of all, you're going to have to, there's 4 categories of eligibility: residential income eligibility, categorical eligibility, and nutrition risk eligibility. Proof of identity and residence and household income will be verified for the program eligibility, and a medical office assistant will collect your height, weight, and a blood sample to check your iron levels, your HGB levels. A nutritionist, or what we call as a CPA, which is a competent professional authority, will ask a few questions pertaining to your daily eating habits, health status, and any nutritional or medical conditions. The information will be assessed by the nutritionist for any nutritional risk factors. Nutritional education, counseling, and a plan of care tailored to your dietary needs will be provided. Again, you must meet the 4 program eligibility requirements to qualify for WIC. If the requirements are met, you will be certified by the CPA, and a food benefits package will be created or prescribed. The support staff member will issue you an eWIC debit card and explain how to register and use the card at participating stores. And some of the foods that WIC offers are, of course, milk, cheese, yogurt, 100% juice, whole grains, eggs, beans, peas or lentils, peanut butter, fruits and vegetables, tuna or salmon, formula, infant fruits and veggies, and cereal for the babies. Now, these foods are eligible by category status. For instance, tuna and salmon are only given to fully breastfeeding women or pregnant women who have multiple gestations, who are having more than one baby in the current pregnancy. And so some fun facts about WIC. We have over 50 stores in the Cumberland County area that you can go to and use your WIC card. There are 1,700 stores in North Carolina that participate in WIC. The eWIC card works like a debit card, so that's pretty simple. The EBT Edge app simplifies the shopping, and the old benefit app no longer works for our clients to view their WIC benefits. And just a little bit about child nutrition. Healthy eating is important at every age, especially for a child's growing body. Kids need to eat a variety of foods from each food group. Fruits and veggies are packed with important nutrients like fiber, potassium, and vitamin C. Fiber fills kids up and helps with digestion. Potassium helps muscles and the nervous system work effectively. Vitamin C helps fight against illnesses and heal wounds. Fruits and veggies also helps with hydration because of their water content. Grains helps kids stay energized throughout the day. Whole grains like oatmeal, quinoa, and brown rice are good sources of fiber. Dairy contains good sources of nutrients like calcium and vitamin D. Both are needed for building of strong bones. Protein promotes muscle growth, aids in repairing tissue, and strengthens the immune system, as well as providing energy for the body. Proteins are also building blocks for blood, bone, skin, and other body parts. Protein foods include lean meats, eggs, fish, dairy, black beans, hummus, and nuts. And then cutting down on foods with added sugars, salts, and fats are also important for a child's nutrition. And one more thing about nutrition for pregnant women. To deliver a healthy baby, pregnant women should eat a variety of healthy foods from each food group. Foods rich in calcium, like milk, cheese, and yogurt, and leafy greens, helps babies' bone development. Folate food sources such as beans and lentils, nuts, and fortified cereals or breads decreases the risk of birth defects. So that's very important to get plenty of folate in the body. Iron-rich foods like lean meats, eggs, tofu, whole grains, and peanuts are important for blood development. And it also carries the nutrients. Nutrients are carried by the blood to all the body organs, so it's important for a good amount of iron. And then foods high in protein help the baby grow and helps expectant mothers build, maintain, and repair tissue. All right. And that's just a little bit from the slide from my presentation. Now, back to Ishmael.
Yeah, absolutely. So I wanted to ask you too, while I'm sitting here listening to you speak, I'm curious to know, what that process is like for an expecting mother or a mother, that's already kind of coming to their thing and they're looking to get into WIC. How was that first meeting, or how was that first appointment?
The first appointment is going to be the longest one because you have to bring in all the documentation that has to be verified.
I see.
So it can take, depending upon how many family members are being qualified for WIC at the time, it can take maybe for about 20 minutes or longer. But we try to move it along because we do have a lot of clients who come in to participate or want to participate.
Right.
And, people have busy lives. So we try to get them out as quick as possible, but make sure that they have what they need as far as counseling and nutrition and all of that.
Absolutely. That was wonderful. So I'm going to check the chat here to see if you have any questions. I'm not seeing you currently. We're getting any. But I will ask you this one question. WIC, they offer a lot of programs, a lot of great things going on. What's one thing that you personally wish that more people knew about WIC, or one particular aspect of the program that you would want somebody to know about?
That WIC is, a pretty caring program. Mm-hmm. I mean, we want to make sure that everyone is eating the best that they can. We know the issues now with, economics and inflation and, foods are much more expensive, now than it was in days before. But we want to make sure that that people do come in because, like we said, it is a supplemental program. So we're not going to be able to provide everything, but we can provide, something which will help these families out. Absolutely.
Yeah. I always believe something's better than nothing, right?
Right.
Something's got to be better than nothing. So that definitely having that supplemental. I know I'll share a personal story, right? My mother was actually a WIC nutritionist for about 10 years.
Okay.
And she would come home, and she would tell me about how a lot of the mothers that would come into her office would share with her, some of the struggles that they were having and just feeding their children properly, right? And making sure that they get those things.
Right.
And even in her experience, and as somebody that is outside of WIC per se, I know how much that really does do for families. I know how much that really does do for mothers and the children. And, everybody likes to eat good. So
we provide a lot of nutritional tools, handouts, information, recipes, healthy recipes, things like that, that will help our families to make that effort into eating better for the entire family. So
could you share with us some of the locations that we can find some information if somebody wants to go look into WIC and they're looking to join and get started with the process, they go to the website?
Yeah, you can go to the NC Department of Health and Human Services Nutrition Branch website, which I have it on one of my slides. And I can give that out later in the program. But that is one of those. Then there's the myplate.gov link website that you can go to. Has a lot of information for everyone, not just for children, but for adults as well.
Amazing. Wonderful.
I did want to chime in as well, as far as our locations as well. So WIC has multiple locations in Cumberland County. So we have a location here at Ramsey Street, which is here at the Health Department, 1235 Ramsey Street. We have a location that is on Fort Liberty. We have a location that is in Spring Lake, and we also have a location that is in the Hope Mills area as well. So I just wanted to point that out as well.
Amazing.
Yes.
So this is available. All these locations are available.
Yes. So our Fort Liberty location is available on Tuesdays and Thursdays. Our Spring Lake O location is open Monday, Wednesdays, and Fridays. The other locations are open Monday through Friday.
Wonderful. Thank you for sharing that too. Yeah. So I want to kind of get into some of what are some other things we're here to speak about and share, right? So I'm learning more and more as I sit with these ladies, and I'm enjoying it currently. I want to get into some of, Taryn, what you have set up for us today.
Yes. So I'm here to talk about breastfeeding. So Tabitha talked about the WIC program, how it affects nutrition with children, also for pregnant women. So I'm here to talk about infants and maternal health and just the benefits of breastfeeding to them, both the infant and the postpartum mother.
Absolutely. Okay.
Okay. So back in 2022, the American Academy of Pediatrics, they changed the recommendation. So the new recommendation is for exclusive breastfeeding for the first 6 months of a baby's life, followed by continued breastfeeding with complementary foods. So solid foods or pureed foods, and then also continued breastfeeding for the first 2 years of life and beyond, as long as it's mutually desired between mother and the baby. So the American Academy of Pediatrics, they changed its stance because there's more and more research that says that there's benefits past breastfeeding past a year old. There's benefits to breastfeeding into, 2 years old. It's benefits for the child, and there's also benefits for the mother. And so the longer that a person breastfeeds, there are more benefits for the mother and also more benefits for the child. And so as far as breastfeeding rates are concerned, we are unfortunately not meeting that stance with what the American Academy of Pediatrics says. Right now, the most recent research says that 83% of women are initiating breastfeeding, but which is excellent. But by the time a baby is 6 months, the rates are down to 25% for exclusive breastfeeding. And so that's a big difference between when they initiate it versus 6 months later with who's exclusively breastfeeding. And so as the baby gets older, unfortunately, as over 6 months, those numbers continue to decline. So we want to try to find out what can we do to increase those breastfeeding rates? What can we do to support women with breastfeeding and get more infants to start breastfeeding and continue breastfeeding as long as mutually desired between the mom and the baby?
Absolutely.
And so some of the barriers that some people can have and why they don't breastfeed, one of the first ones I think is offering formula. So formula supplementation. Breastfeeding works with supply and demand. So the more you breastfeed, the more milk your body will make. Your body actually starts making breast milk during your pregnancy, and it doesn't wait until after you deliver to start making it. So when a woman is pregnant, her body knows that she is pregnant, and her body starts producing breast milk then. And so if formula is offered, unfortunately, babies don't eat as frequently from the breast because they're full from formula, and that can affect a woman's milk supply. And so her milk supply can decrease, and that can be one of the barriers with breastfeeding because sometimes babies tend to prefer a bottle. Those things can be a little bit challenging for a new mother with breastfeeding formula and also offering a bottle, and baby may not want to breastfeed as frequently. And then stigmas against from family, from friends, and especially the longer women tend to breastfeed, there tend to be more questions. Well, when are you going to do this? And when are you going to do that? When are you going to stop? It's a stigma associated with that long-term breastfeeding, or extended breastfeeding is what they're calling it. Breastfeeding past 1 year old, there tends to be a stigma associated with it, and may not be as much support from family or even friends. And I'm finding that as well. A lot of people aren't as knowledgeable about breastfeeding and how our body works and how our body produces breast milk. And so if you don't have that knowledge, you may not know what happens with your body and what you should do. And that in itself is a barrier. So definitely just try to, we at the WIC program with our CPAs, our breastfeeding peer counselors, me, myself, we try to educate women about breastfeeding and families about breastfeeding. Well, so that way they can be supported, they can get knowledge, they can get education. So that way, whatever their breastfeeding goal is, they can meet it.
So if you don't mind me stepping in and asking, what are some of those stigmas that a lot of people may come across or may have out there?
Stigmas about how they don't want their body to change.
I see.
Stigmas about how they don't want the baby to be so attached to them. Stigmas about they've never seen anybody do it.
I see.
I don't know anyone who's breastfed. Breastfed is only for certain people. So there's a lot of stigmas out there that people think of that I've heard personally from different participants that they think, they just either don't know because they haven't seen it, or it's different things that they have heard from other people and are uneducated or unaware.
Amazing. Thank you for sharing.
You're
I just had to ask that question.
Okay,
Yeah,
that's a good question.
Absolutely.
That's a good question. And another barrier is workplace. A lot of women are working, and a lot of some of the supervisors are not necessarily aware of the federally mandated laws concerning breastfeeding and pumping. There are pumping laws that are federally mandated. Supervisors may not know, but Human Resources does. And so some women think that they can't go back to work and breastfeed. I have to stop breastfeeding before I go back to work because either I don't have a place to pump or I just can't, I don't have time to pump, depending on the kind of job that they do. And so federal law says that your place of employment must provide a place to pump, a private place to pump. That's not a bathroom. They also must provide a time, reasonable amount of time is what the law says, for you to pump up until your baby turns 1 year old. So that definitely can be a barrier because a lot of people are not as knowledgeable about these pumping laws and that they can pump whenever they go back to work.
That's something that they're able to do.
Yes, and that's a great thing that the government has put it in place for women to be able to pump while they're away from their baby. So that way the baby gets the good nutrients that can help the baby grow.
Absolutely. Amazing.
And so now we're going to talk about some of the benefits of breastfeeding. So for a breastfeeding person, it lowers the risk of breast cancer and ovarian cancer. It lowers the risk of type 2 diabetes and high blood pressure. And so these are the major things that that in the beginning where I said the longer you breastfeed, the more benefits it has. And for the women, these are the major things that are affected with continued breastfeeding. Ovarian cancer, lowers the risk significantly. Breast cancer, type 2 diabetes, and high blood pressure, they're significantly decreased whenever a person breastfeeds, and also the longer that they breastfeed. It's a better recovery after childbirth. So whenever a person is pregnant, their uterus expands to accommodate the baby. And whenever they breastfeed, it actually helps their uterus kind of shrink back down to the size that it was prior to pregnancy. So there's less bleeding, less risk of hemorrhage, and it helps with postpartum recovery because of that fact. It helps burn calories. So it's almost, I call it like a mini workout. So every time you breastfeed, every couple of hours is like you're working out. So it helps burn calories. Some people say it helps you to kind of get back to your pre-pregnancy weight. I won't necessarily say that because it doesn't happen in every case, but it definitely does help you to burn some calories each and every time you breastfeed. It's convenient, it's warm, and it's always ready to go. So we're definitely, still, we're out of a pandemic now, but while we were in the midst of a pandemic, breast milk is always available. When there were shortages with formula, breast milk is always available. So it is always ready to go. It's always warm, and it's definitely convenient, especially in the middle of the night, to be able to wake up, feed your baby, and go back to sleep.
It's definitely one of the great benefit.
Yes.
Compared to formula. Yeah.
Definitely.
I actually had some clients who were going to formula feed their baby, but during the pandemic, they were so worried about giving baby the particular formulas that were having issues with it. They decided to breastfeed, and they did well with it, and they were really happy that they could do that for their babies.
Exactly.
That's amazing.
Exactly. So I think that the pandemic definitely has shifted a lot of people's minds and thought processes about breastfeeding. And like you said, in an instance where they may not have, now they decide that they're going to because of the benefits and also because of the shortages. Just like there were shortages with toilet paper and everything else, there was shortages with formula as well. So that definitely was a good thing that they decided to breastfeed. So some of the breastfeeding benefits for the baby, the benefits for the baby is it provides optimal health. It has the right amount of fat, proteins, carbohydrates, nutrients to help your baby grow. It also helps baby's brain development, so that way your baby can grow appropriately. Babies who are breastfed have lower risk of ear infections, and they have less reoccurring ear infections, especially as the mom is breastfeeding longer. So it's significantly decreased. And then SIDS, which is the sudden infant death syndrome, babies who are breastfed, they have less risk by 64%. Of SIDS whenever they're breastfed. So there's lots of benefits for the baby. Respiratory issues are less, pneumonia, flu, a lot of different respiratory illnesses are definitely significantly decreased whenever a mom chooses to breastfeed the baby. But one of the biggest benefits, I think, is just the improvement in baby's immune system. So whenever a baby is breastfed, the mom's antibodies that she has is produced and given to the baby through breast milk. And so it improves the baby's immune system. And so babies who initially don't have an immune system whenever they're first born are given an immune system from the mother, and the baby's immune system is improved because of that reason, with mom providing the breast milk for the baby.
That's something you don't necessarily get from formula.
Exactly. Formula is necessary, but the composition of breast milk changes as the baby gets older. And so that's not something that formula does, unfortunately. It's going to be the same. Whenever your baby is sick, your breast milk produces more antibodies that help the baby get better sooner. That formula honestly just doesn't do. It's not the same, exactly. And so those antibodies protect the baby, protect the baby's immune system, and help your baby to get better sooner.
That's amazing.
And no matter how they advertise it as being close to breast milk, it's not going to be the same.
Not quite,
So,
right? Yeah, not quite.
Yeah, there are millions of ingredients and different things like that that are in breast milk that they're continuously doing research on, because they just don't know all of the things that are in it. And so formula companies are adding more and more things because they're doing more and more research on breast milk and finding that there are more and more ingredients and more benefits to it. And so formula companies are continuously adding more things to try to be more like breast milk. But the comparison is not the same. Like I said, formula is necessary, but definitely breast milk is the optimal way to feed the baby because of these benefits.
Yeah. Wow, amazing. Thank you.
You're welcome. Okay. And
we got through some of the benefits, right? We briefly touched on some of the myths or stigmas, right? So I guess we're getting into the last one is there any more benefits or any? I guess I should ask: are there any risks? To breastfeeding?
Yes. So in certain instances, you should not breastfeed. If a mother has HIV and she's not on antiretroviral drugs or therapy,
I see.
or if she is on the, they call it ART, antiretroviral therapy, but her viral load is not suppressed, meaning that you can detect the HIV in her system, then you shouldn't breastfeed. Because of course that the HIV can be passed through the breast milk to the baby. But I think in 2023, they made those new changes to where, if the viral load or viral suppression is there, if the viral suppression is not detected, then mom is able to breastfeed with consideration from her healthcare provider. So that healthcare provider is continuously making sure that the viral load is suppressed, so that way there's low risk of passing the HIV to the baby. Certain medications, there's a lot of medications that you can breastfeed and take, but certain medications, they have found that it's just not safe for the mom to take because it can pass certain things to the baby. If someone has herpes and they have a lesion on their breast, an open lesion on their breast, then they should not breastfeed because, of course, those things can be passed to the baby. But in most instances, it is safe to breastfeed, and there's not many risks to breastfeeding, but definitely that should be something that someone should have a conversation about with their healthcare provider. If they have concerns, if they have questions, they should definitely talk to their healthcare provider about those things while they're pregnant. Or if they're in the midst of breastfeeding and something comes up, they should definitely have a conversation with their doctor, so that way they can get all of the information and the risks are made known to them.
Absolutely. Absolutely. It's great to be informed about your body during that process. Yeah.
Definitely. And so you were talking about, earlier we were talking about the benefits for mom and baby. There's also benefits to the community. So benefits for the community, less use of natural resources. So paper, plastics, metals, different things like that. It's less whenever somebody is breastfeeding, less waste in the landfills from cans, bottles, different things like that. Also expenses, medical expenses. So when a baby is breastfed, they have lower risk of doctor's visits, hospital visits. So that's less money out of somebody's pocket that they have to spend taking their kid to the emergency room. So those things definitely do make a difference. And then the cost of formula. Formula is very expensive. And so using that money, whenever I calculated, it was $1,000 to $2,000 over a year for a formula fed baby. And that's also just kind of depending on what formula that they are on. So it could possibly be more than that. And so imagine all of the money that we're saving either individually, healthcare wise, and environmentally. Makes a difference.
Absolutely. That's kind of going back to what we were discussing earlier with WIC and being able to get those things. I mean, it's costly. It's costly. Formula is costly. Good quality food is costly. So any program where you can kind of counteract that cost or cut that, I feel like that's pretty beneficial.
Definitely.
Right? Yeah.
Definitely. Okay.
So where are we in our flow here? We're getting into our flow.
Yeah, we are.
So we've gone through some of the myths. I guess we can go read some of these as well.
Okay.
Some of that up there.
Okay.
I know we got a limited time.
Okay.
But definitely want to make sure the information gets out there, right?
Definitely.
Yeah.
Okay. So these are just some of the myths about breastfeeding, things that I've personally heard, or things that some of the other CPAs I'm sure have heard as well. You can't breastfeed if you don't eat right. I have to eat healthy to breastfeed. Not true. Of course, we would want you to eat healthy. I'm a nutritionist as well. I would want you to eat as healthy as you can, but you not eating healthy is not going to affect your ability to breastfeed. So breastfeed on, but definitely just try to make sure that you're eating as well as you can. You can't breastfeed if you're stressed. That's not true. Unfortunately, the baby does feel your stress and anxiety, and all babies do, but you can still continue to breastfeed even if you're stressed. You can't breastfeed if you have a nipple ring. We want you to take your nipple ring out so you can feed the baby. But that is a possibility that you could still continue to breastfeed even if you do have a nipple ring. If you didn't breastfeed with your last child, you had difficulty last time, doesn't mean you'll have difficulty this time. WIC is here to support you. There are other organizations, international board certified lactation consultants that can help you. So that way, whatever your issue was last time, we can try to get you help and support. So that way you hopefully won't have the same issue. You can't breastfeed if you're sick. If you're sick, your body's producing antibodies. Those antibodies will pass to the baby.
Absolutely.
Who likely won't get sick. I remember having a participant and she had COVID. She breastfed the baby. All of the other family members had COVID and the baby did not.
Wow.
The baby did not. And you can't breastfeed if the baby is sick. Again, the same situation where putting babies to the breast, your body recognizes that your baby is sick. Your body produces more antibodies to protect the baby, and your baby gets better sooner. So all of those things are definitely myths, and you can continue to breastfeed through all of these situations.
It's great information to know.
And so my job as a breastfeeding coordinator is to help people to get as much breastfeeding knowledge, education as possible so that that way they can make a good decision. We want breastfeeding to start off well. Try to get as much information while you're pregnant as you can. So reading books, watching videos, taking breastfeeding classes online or in person, doing skin to skin with the baby, talking to your doctor about breastfeeding while you're pregnant. All of those things make a difference. So definitely just try to do those things while you're pregnant. When you have the baby, do skin to skin. And try to nurse the baby 8 to 12 times a day in 24 hours and ask for help and support. So WIC is here to support breastfeeding. They're also, we call IBCLCs. Those are lactation consultants. They are healthcare professionals that their specialty is breastfeeding. So if you're having issues, reach out to them. We have a few in the area. We have 4 in the area. Most of them take all major insurances. It's covered by your insurance.
That's great.
So reach out to them so that way they can support you and WIC can support you as well.
Absolutely. Wow. Thank you. Thank you so much for sharing that information. I know I'm going to sure that some of these things are available to the public, but I think hearing it from someone that's actually involved with the work, someone who's available to them as that resource is priceless. You know, I kind of want to get into some of the parent-child going from WIC going into breastfeeding and kind of, bringing it all together. So essentially some of the things that I'm receiving is that our nutrition should be a priority, right? Not only the mother, right, but also the baby, also the child. You want to make sure that that relationship is a healthy one. And we've seen how important that is, especially through breastfeeding, since the baby receives a lot of those antibodies and immune support and just all the love, right? Get that love from mom, right? So I also wanted to just kind of spin back. I know we've got limited time. We're coming up here and we'll take some questions if anybody has some here in a few. But I wanted to switch gears to this last little bit. We're going to share a little bit of information before we go and get some here on the child development. So last slide. All right. Here we go. Speaking on child nutrition. And so, again, to kind of sum up why these things are so important, why good nutrition, especially with children, is so important. You definitely want to have optimal growth for the child, right? Like we mentioned, it boosts immunity, having a mother who breastfeeds as compared to someone who maybe uses the formula. There's more benefits there, right? When you have healthy eating with the children, they're able to get that food, have a good breakfast, have a good lunch, have a great dinner, whether they're at school or home. Enhances cognitive function and that development, right? And preventing future health instances or diseases. Now, a lot of disease stems from our nutrition. A lot of it stems from what we eat. You know, they say we are what we eat, right? So whenever those things that we're eating and consuming are of lesser quality or not quite what they could be and what is available to us, we kind of take that, and we suffer for it, right? So those are some of the great benefits as well. Do a few of these, a few here too. But some of the things that most children definitely need as far as proper nutrition, definitely plenty of proteins, right? That's something that you can get. Carbohydrates, which are some things like whole grains, fruits, vegetables. Those are the good carbohydrates. You also, they have bread, which is also something that you need. But those fruits, whole grains like that, vegetable, those are some of the better carbs that we like. There are sources of healthy fats as well. I know there's misconception out there about fats being, that's something you want to stay away from. But the body does need those things. The body definitely needs those things. So healthy fats, those are things that you need as well. Some things like avocados, certain types of fish, nuts, almonds, those things contains fats that are good for the body as well. And of course, vitamins and minerals, right? Those things that help improve our day-to-day function. Those are crucial, definitely crucial for multiple bodily functions. One of my favorite vitamin nutrient-rich foods is sweet potato. And that's something that is easy to make, something that you can get and it's simple, making it home quick. If you're somebody that prefers the baked route, you can do that. But also, it's one of the things that fit perfectly in the microwave as well, too, So it's definitely ways to do that. And going into that, you want to eat your colors, eat the rainbow, different things, different fruits, different vegetables, definitely spinach, carrots, those things as well. And that's essentially kind of just a great start. Like you mentioned, the My Plate, that's a resource that I would base off as well. And that's something that we have on our website. Back in the My Plate, you want to have at least a quarter of fruits, at least a quarter of grains, mostly vegetables, and then that protein as well, with a good dairy helping or a classic water. Water is always a great go-to. So definitely the My Plate resource. And these are all resources that we have on our website. There are resources that you can find on the county website, WIC Department breastfeeding website, where their section as well. All this information is available. So I want to kind of wrap up here and ask the chat to see if we have any questions, anything that you all would like to go over, or if you all have any questions for each other or for myself, anything that may be out there or something, anything else that you'd like to share or let us know what's going on in your departments.
I just want to talk a little bit about how dads can help with nutrition, because sometimes dads feel like they're left out. Dads can, help with meal planning. You want to make sure that the children are seeing dads eat healthy too. So they have to be good role models as well. And just bond with your children. The more that you bond with them, and the more that they see you eating, preparing healthy, nutritious foods, they're going to want to be interested in that too.
Absolutely. That's very true. So I see one question here we have in the chat is, can people help support breastfeeding in the community? Are there any ways that people can support breastfeeding mothers and families in the community?
Yes. So one of the ways that you can help is educating yourself on breastfeeding laws, policies, talking to the place of employment about what they're doing with breastfeeding. Also, we do have the Breastfeeding Coalition of Cumberland County. That is something that we have reignited here. And it's a group of people, individuals, the WIC department, health department. We've got some lactation consultants, doulas. And so we're here to support breastfeeding, educate breastfeeding, promote breastfeeding. So if anybody is interested, please Google Breastfeeding Coalition of Cumberland County. So that way it'll give you the information on who you can contact. Her phone number, contact information is there. But definitely just try to promote breastfeeding as much as you can. And then try to educate yourself.
Yeah, absolutely. That's one thing I could say, kind of to tie the two together as well for dads and a lot of men, right, in the community. I'll speak on our behalf as well. Another great way to support is, support your wife, support your spouse, support them in their appointments, be there for them and listen to them. A lot of times, man, we can be gone, busy, right? But just spending that time, spending a little bit of time and a little bit of attention, especially with older kids as well, with their nutrition and setting an example, right? Kind of being somebody, hey, I eat well too. Dad's healthy. Dad's out there working. He's doing different things, right? He's eating good. So they see that and they want to follow suit, right? So that's a great thing to have an example. Also getting, as far as community work, there's a lot of great organizations out there that you mentioned. That are available. People are looking to spread advocacy, spread word, right, and to get that out and support. I've noticed that there's more resource and more attention on breastfeeding, and in particular in relation to men, more so now than there has been. Definitely. So that's a great thing, right? So we want to continue that. Well, just in closing, again, my name is Ishmael Meacham. I'm a community health resource advocate here, community health worker here in the health department. And I'm here with my colleagues, Ms. Tabitha, Ms. Taryn as well. I want to thank you all for sitting with me today and getting to some good information, get some good stuff out there. Is there anything else you'd like to say in closing or anything else you'd like to share?
No, thank you.
Thank you for having us.
Absolutely. Wonderful. Well, we'll close our Hello Health session with that. We'll be back next month as well. April 24th is our date. We'll be speaking about the teen clinic and sex ed, some family planning things, and that will be going on well into May as well. We'll have another colleague here to speak. Again, in closing, my name is Ishmael Meacham. This is our Hello Health session for March. Thank you so much for attending and checking us out.